In recent years, there's been quite a substantial increase in the amount of gluten-free diets in America. This sparked our interest as to why this diet has become so popular, and, more specifically, what effect it has on people without celiac disease. Gluten avoidance is legitimate research-supported treatment for those with celiac disease and those suffering from irritable bowel syndrome. The existence of gluten sensitivity, to a certain degree, is supported, and gluten-free diets have been prescribed for those with gluten sensitivity. Some humans are largely vulnerable to the toxic effects of gluten, particularly due to a lack of adequate evolutionary adaptation of the gastrointestinal and immunological responses. Gluten-free products are perceived to be healthier than their gluten-containing counterparts due to endorsements from celebrities and increased awareness about the potential health benefits of gluten avoidance. Between 2004 and 2011, the market for gluten-free products grew at a compound annual rate of 28%. Gluten avoidance among children and adolescents without a previous diagnosis of celiac disease is normally a result of nonspecific behavioral and gastrointestinal complaints, and perhaps with the perceived dietary responses of another family member thought to have celiac disease. The percent of the population with gluten sensitivity may have been previously overstated in recent years. Those with gluten sensitivity represents less than 1% of the population in 2009 to 2010. Compared to non-gluten-free foods, gluten-free products have consistently lower protein content across all three core food groups, in particular for pasta and breads. In those without gluten intolerance, eliminating gluten may offer no nutritional or performance benefits. Many symptoms experienced by gluten sensitivity patients may likely come from other aspects of whole grains rather than gluten. Components of wheat and gluten are beneficial in creating healthy composition of gut bacteria, which may protect the gut from some cancers, inflammatory conditions, and cardiovascular disease. Additionally, intake of wheat gluten could have beneficial effects on cholesterol, which are attributable to the gluten itself rather than the wheat fiber. Whole grains have many components that are linked to reduced risk of CHD, cancer, diabetes, obesity, and other chronic diseases. More research is needed to determine the extent at which gluten sensitivity exists and how exactly it should be diagnosed. Non-celiac gluten sensitivity is an entity awaiting validation, better diagnostic criteria, and, if it does not exist, pathogenic mechanisms. The reluctance to acknowledge other components of wheat as potential pathogenic factors has often hampered good interpretation of clinical observations. Although the expected population for which a gluten-free diet would be beneficial is minimal, further research is needed to determine who is affected by gluten sensitivity and to improve the standardized diagnosis for gluten sensitivity. It does not appear to be in a person's best interest to partake in a gluten-free diet unless instructed to by their doctor.